have deliberately not written the above 40 part because I feel that skincare is essential for every single person, whether you're a child, adult, or middle aged. So I'll be presenting on skincare. I am practicing in Noida. So let's begin. So why do we focus on skincare? Now, as we age, the most common concerns are dryness, thinning of the skin, loss of elasticity, and fine lines and wrinkles. So the objective here is to give you general knowledge so as to equip yourselves to have a practical skincare routine. Now, what all skin changes happen with age? Now, our skin tends to change every 5 years. As we age, whether we're from childhood to adulthood, our skin keeps on changing. It is influenced by a lot of things like the environment, our diet, our habits, what sort of soap or water that we're using. All these things do impact our skin. But as we age, post 30, post 40, the collagen production really decreases almost up to 30%. The skin tends to become more fragile with age because the thickness of the skin decreases. There is reduced oil production, though for some it also means that there is less acne, but for a lot of people it means that there is dryness. And the skin also tends to react more. We usually see complaints where people who have used dye for quite a bit of time in their lives, as they turn older, they tend to become allergic to it because the skin sensitivity increases. So, what is the basic biology happening behind it? There is some role of estrogen as well, where it affects the fibroblast activity. The glycosaminoglycans that form the network of the skin, they tend to decline. So there is decrease in hyaluronic acid, decrease in hydration, which always will lead to dryness. Now the lipid barrier, that also gets impacted. The ceramide levels, they drop. That is why there is more transepidermal water loss. So you have to ensure that you are well hydrated and there is regular use of moisturizers. Now, coming to the main question, what do we do in a skincare routine? Do we do a simple skincare routine? Do we have a elaborate 7-step skincare routine, or the common social media fads where you need to have a Korean 10-step routine? See, the thing is, all these routines, they're well and good, but they do not suit everybody. Your skincare routine has to be always catered to your skin. It should be something that you can do on a daily basis, like we go to bathe or we brush our teeth. Skincare has to be something that is feasible for you. It should be simple enough that you are able to do it on a daily basis. Only then you will reap the benefits. Doing a 10-step skincare routine once in a while is fine, but doing it on a daily basis, especially when you're a busy gynecologist working very odd hours, it is difficult. And most of the times, it is not required. So, what is required? You have a basic skincare routine where you cleanse. You can use surfactant free lipid replenishing cleansers that have ceramides. They will hydrate your skin, they will not cause a lot of allergies, and they'll be gentle. The next thing that one can include is focus treatment. You can focus the treatment for, say, anti-aging or for depigmentation or to even out your skin tone. It depends from person to person. One shoe fit all does not work. It has to be catered specifically to you, what your skin needs, what your skin concerns are. A lot of times, people will advise you a lot of things, even dermatologists. But what you need to understand is when you look at yourself in the mirror, if something is bothering you, then you work on it. It doesn't matter what the other person sees, it matters what you see. So, coming back to focus treatment, in the morning, antioxidant serums like vitamin C or E can be used, but make sure that you use sunscreen after vitamin C. And the newer molecules like peptides, copper peptides, they really help with anti-aging as well. In the evenings, retinoid is a big favorite when it comes to dermatology and anti-aging because it does have very good effects. But with retinoids, you have to know how to use it. You have to be slow about it, and it should be titrated up. You can't just randomly start using retinoids and be okay with it because yes, do cause a lot of irritation. They can cause redness. They can cause a lot of dry skin. And if your skin has been acne prone in your younger years, you can have something known as acne purge, where when you start using retinoids, say maybe a week or 2 weeks later, you see a gradual or a sudden increase in outbreak, pimple outbreak. We call that the retinoid purge, that whatever was building up below the surface suddenly comes up. So retinoids have to be used very carefully. They're a beautiful ingredient which will give your skin a lot of benefit, but you have to use it properly. You need to use it in less quantity. Slowly increase the routine. When I say slowly increase, I mean that you use it, say in the starting, you use it only 2 times in a week. Then you increase it to alternate, and then maybe if required, you can increase it to daily. Always has to be used at night. But if you feel that, by using twice in a week, you are seeing improvement, you can do that as well. Always, always, always follow retinoids with a moisturizer so that the problem of dryness and sensitivity doesn't happen. And the next morning, wash it off and use a sunscreen. That is the basic of retinoid. Then coming next to what I've been saying again and again is moisturization. So we really need to reinforce the barrier of the skin. That can be done with ceramide creams. So the normal moisturizers that you get in the market, they may or may not have ceramides. A lot of moisturizers that you get in the market, they purport shea butter or cocoa butter. That is well and good. But if you have dry skin, if you have sensitive skin, or if you have skin which is very prone to dryness, and those moisturizers are not somehow, resolving your dryness issue, then you should go for medical grade moisturizers because they have ceramides, sphingolipids, cetyl fatty esters. All these, they help reinforce the skin barrier. Why? So if you visualize the skin like bricks on the wall, the cement in our skin is made of fats and lipids. So these medical grade moisturizers, they help reinforce that skin barrier. And we realize that if we use medical grade moisturizers, half of the skin problems that we face, they're reduced. Now coming to the most important thing, that is UV protection, sunscreen use. Broad spectrum SPF should be used. Anything above 30 is good for the Indian skin, but more than applying the higher amount of SPF, what is important is that one, you apply it daily, whether it is sunny, winter, or it is raining, you should apply it daily. One. Two, you need to reapply it 3 to 4 hours later. If you're out and about, you're traveling, or you're out in the sun, you need to reapply the sunscreen for it to be effective. And the second is that you apply the right quantity. At least 2 big pea-sized amounts of sunscreen you need. All other skincare, a little bit pea-sized amount goes a long way. But with sunscreen, you need a good amount for it to be effective. So now we have so many products in the market, different brands. This photograph is not my recommendation. This is just for demonstration purposes. So now what ingredients you should look for? So if you want deep hydration, you can go for hyaluronic acid, but always remember hyaluronic acid works as a humectant. That means it absorbs water from the surrounding area. So if your skin is really dry, it might not be very effective. So what do we do? After you use hyaluronic acid, make sure that you use your moisturizer as well. Hyaluronic acid does not work as a moisturizer. It works as something that hydrates our skin. So you have to use your moisturizer with it. Retinoid, like I said before, it boosts cell turnover and it reduces fine lines. But always go slow and be mindful with retinol. Peptides, that are the newer supplements, especially for people who don't want to use retinoid or they're allergic to retinoid. Peptides and copper peptides, they stimulate collagen production. Why collagen production? Because it will make our skin look more plump, more hydrated, and more smooth. Vitamin C will brighten and it will protect against free radicals. Niacinamide will reduce redness and improve the elasticity. Ceramides, like I explained before, they act as the cement in our skin. They will strengthen the skin barrier. Now, what other treatments we can go for? So these are basically the dermatology based treatments that you can get at a dermatology-based clinic or hospital. So the first is chemical peels. Now the chemical peels, there are at least 20 to 25 peels out in the market. It depends what you are looking for, whether it is hyperpigmentation or you have uneven skin tone or you're just looking for that glow up before a party. It varies from person to person. So your dermatologist will cater your peel according to your needs. There are a lot of peels that can be done. The downtime is not much. It is a very simple OPD procedure that will probably take you 5 to 15 minutes to get it done. The downtime is varies from person to person, but if you're getting a medium to a superficial peel, then it's usually 2 to 3 days. You just need to apply moisturizer and sunscreen. There isn't much to it unless you're going for a medium depth peel or a deep peel like TCA to stimulate collagen. Those peels they take at least a week to 10 days of downtime. Next, coming to laser treatments. So if people they have uneven skin tone or their pores are very visible or you had acne scarring as a young person, then you can go for fractional CO2 for collagen remodeling. If somebody has some vascular concerns like your veins are really visible on the face or there's a lot of redness, then you can go for intense pulse light. That's another type of laser, but it does not use laser, it uses light, LED light as the medium. Then coming back to laser, Q-switch Nd:YAG laser, this is a very common laser that is used for laser toning. It works on uneven skin tone. It also somewhere or the other does help with fine lines. And a lot of Indian females, they suffer with peach fuzz. That is basically the fine hair that you see. So Q-switch laser that helps in bleaching out those hair and brightening your face, make it look more even tone. Because with age you see darkening in this part of the face or maybe in this area of the face. So Q-switch laser it helps with that. That being said, these lasers are never a one-time treatment. You need to get them done at least 3 to 4 times before you see any good results. Then the other thing that can be done for anti-aging is microneedling with PRP. This basically enhances skin elasticity and has a skin rejuvenating effect. So what is PRP? PRP is platelet-rich plasma therapy. We take your blood, we centrifuge and separate the platelets, and we use the concentrated platelets with the serum and we inject it back into the skin. Now, why are we doing this? So PRP, because the platelets, they have growth factors. Now, these growth factors, they have been seen that when injected in the skin in bolus doses, they stimulate the collagen activity, which has decreased considerably post the age of 25. The other modality that you can use with or without PRP is microneedling RF. Now, what this does is microneedling in itself can be done with derma rollers or microneedles. Microneedling RF, as the photo demonstrates, it basically they are very tiny needles that penetrate the skin and they cause micro trauma in the middle layer of the skin, the collagen. They release bipolar RF energy, and that energy basically stimulates the fibroblasts and the macrophages to produce more collagen. So when you get the procedure done, you will just experience redness. But post the procedure, once the redness subsides, the collagen, takes its time to get resynthesized. You will experience much softer, smoother skin. This is just with microneedling RF. The PRP that can be injected that does not cause any redness on the face, maybe a couple of bumps on the forehead. That's about it. This is also similar to something known as vampire facial, if any of you have heard of it. That's basically microneedling with PRP. The term vampire facial has been given because when you do microneedling with PRP, it tends to really make the face intensely red and the pinpoint bleeding spots, they leave a little bit of blood. So it's called vampire facial. Then coming next to tightening, a lot of people post the age of 40, they complain of loose sagging skin, like this jowl area or maybe the cheeks. They tend to sag a little because the fat pads of the face that tighten the skin and make us look younger, they tend to shift with gravity and aging. So if somebody has a sagging face but not a bulky fat face, they can go for something known as thermage. This is based on radio frequency and it helps in skin tightening again by stimulating collagen. Now, if one individual does have a bulky face, when I say a bulky face, I mean something chubby, right? So when you have a chubby face, then you can go for something known as HIFU, that is high intensity ultrasound. This is used for tightening, and this basically helps somewhat reduce the fat pockets. So it causes tightening of the skin, more lifting, and more slimming down of the face. The other things that can be done for anti-aging purposes are Botox and fillers. I've not covered those much because those are very invasive. One, two, not everybody wants to go for something where you're injecting things in the skin. Indian market still is a little cautious when it comes to Botox and fillers, but Botox for wrinkles, if you want to get rid of your wrinkles, yes, you can go for Botox. It is not as scary as it sounds. Like if you Google Botox, then it shows very scary photos, but it is very subtle. If done by a certified trained dermatologist, there are very few complications, especially with Botox. Upper face Botox is very, very simple and it can be very easily done. Fillers, it depends what you're looking for. If you want plumping of your lips or you want to lift up your face, then you have the option of fillers and even threads. Threads is basically something similar to sutures that are used for the skin, except they are straight and they are used for lifting of the face from here. So all these options do exist, but you have to know what you're looking for. So it's not like all these options can be done by everybody. It depends what you want to look like, and what is it that is not suiting you, that you don't like when you look yourself in the mirror. So from there you can work on it. But yes, these options are there. So coming to something else that really affects the skin, that is what is inside. So what affects that is our lifestyle and nutrition. So a lot of nutraceuticals can be taken, like omega-3s. Now another fad that is all over the social media is collagen. Collagen can be taken, but you'll have to keep in mind that when we take collagen, it will get broken down to amino acids in our body and it will act as taking any other protein supplement. The benefit here is that collagen, the constituents of the collagen, the amino acids that it gets broken down into are more, relevant and more appropriate for skin, hair, and nails. So it will not bulk you up the way other protein supplements will, but it does help with the skin elasticity and the hair. Other antioxidants like pycogenol, lycopene, and green tea can be taken. So for skin, if you're facing hair loss issues or if you're facing a lot of skin issues, a high protein intake will help improve that. But again, it has to be catered to your personal requirements and whatever other if you are suffering for something else, whether it will suit you or not, it has to be customized. Phytoestrogen rich foods like soy and flaxseed can also be taken, especially for postmenopausal women. Now, exercise, it will boost dermal blood flow and it will reduce inflammation. So it will obviously help your skin and your overall health. Now, other emerging trends that we see these days is that we have epigenetic skincare that targets gene expression for anti-aging. Though it is not that freely available in India right now, but it's just the up and coming thing. Then there are AI-driven tools. A lot of places you will see instruments or machines that will analyze your face and then they will tell you what all treatments or what all things you can go for. Then there is lab-grown collagen and bioidentical lipid formulas that can be taken. Like I explained, the collagen, it can be taken. It is always best to take collagen powder and not the tablets that are also there in the market. Marine collagen obviously is the best, but if that does not suit you or you're allergic to it, then poultry collagen options are available. Sugar-free options are available. And for some people, vegan options are also available if you're a vegetarian. How effective those vegan options are is still undergoing a lot of debate. Hopefully, in some time, we'll know how effective vegan options are, but the marine options, they're definitely effective. There are a lot of microsomal topical preparations available known as Riedel shot as well. They are quite effective in anti-aging, but you have to be very careful when you use them because they can cause a lot of allergic reactions. So coming to the next part, I thought I'll take up some myths as well. The first being that retinoids are too harsh for aging skin. So, like I said, gradual introduction and buffering will reduce the irritation. It's a beautiful product that has very good effect, retinoids, but it has to be used correctly. Natural products are always safer. That is not true. A lot of times, natural ingredients can irritate sensitive skin, they can cause allergies, and sometimes they can even worsen if you have eczema prone skin. Over the counter products are ineffective. That's not true. There are a lot of products in the Indian market right now. Newer companies are coming up with newer serums and rolling stones and gua shas and whatnot. But again, coming back to the basic thing, you have to know what will suit your skin. Applying a lot of things will not help your skin look better. The most basic skincare advice that I can give to anybody is that you use a moisturizer and sunscreen. Beyond that, it has to be catered to every person according to their needs and according to their skin. So if you do have skin sensitivity, always patch test few products. You can apply it in the neck area right here below the ear and see for 2 3 days if your skin is reacting to something instead of applying a new product directly to your face. Avoid harsh exfoliants and alcohol based products. Choose fragrance free and hypoallergenic skincare if you have skin sensitivity issues. To conclude, embrace your radiance. Aging is a natural, beautiful process. Consistent, tailored skincare can help and make you look the best. Consult a dermatologist for personalized advice, and you can embrace a personalized science-backed skincare regimen, which will give you benefit. I'm currently practicing at Reneha Skin Clinic in Noida. For any other details, you can contact me anytime. Thank you.
Thank you, Dr. Akriti, for such a wonderful presentation. So many practical tips for us. I now request our experts for their opinion. Dr. Sharda Jain, ma'am.
I think डॉक्टर आकृति जैसे सभी लोग कहते हैं कि योर टॉक हैड बीन एब्सोल्युटली एक्सीलेंट प्रोबेबली आई हैव टू आल्सो स्पीक द सेम बट आई थिंक मेरे तो सारा सिर के ऊपर से निकल गया I am a woman who is going to approach 78 years and all my life I have never used other than coconut oil and this is what the things are. तो आप जब भी बहुत सारी बात बताते हैं people suggested me collagen you take it for 1 day 2 day and then 3rd day you say no you don't want to taste it all that marine things and everything in all my life I've never used sunscreen for my face and you got to tell us the question is making a presentation and making it flowery you should make a moisturizer